info. And thank you all for coming on and joining the webinar. My contact information was in the email Jessica sent out last week. So if you need it, it is there along with my phone number and email address. So go ahead and get started. So I always like to show this slide to all audiences because a lot of folks aren't familiar with all the different 3-digit numbers that are available across the United States. And so 211 is available across 98% of the country, throughout Canada and Puerto Rico. And it was designated in the year 2000 by the FCC as the 3-digit number for all health and social services. So no matter where you go, you can dial 211 from any phone. It's a free phone call and get connected to a local call center based on your zip code and get connected to nonprofit resources, government resources, faith-based resources. And we are just the how-to, and or you could think of us as the air traffic control of health and social services. And a lot of times folks aren't sure where to start. Maybe we're their first phone call, maybe they've exhausted other options, and so if they're trying to narrow down resources or they're not sure where to begin, we can help narrow down those resources for them. And then some of the other 3-digit numbers, so depending on the jurisdiction where you might reside, 311 would be a government or non-emergency info police number. Everyone knows 411 is directory assistance, 511 for traffic and weather, 611 for cell phone customer support, 711 for TTY service, 811 call before you dig, and 911 is emergency services. And so our service footprint covers the entire state of Oregon and 4 counties in Southwest Washington. And most recently, my role was manager of partnership development for our 4 counties in Southwest Washington. I actually reside in Vancouver, just across the river in Portland, where our contact center is located. And so my outreach footprint touched on all 4 counties, very rural areas, and then a very populated area where folks in Vancouver and folks in Portland often travel across state line for services. So, you know, developing that dynamic and really figuring out how to address the needs of folks. We went statewide in the state of Oregon in 2013, and so that's when we picked up the southeastern portion of the state. And then we have folks throughout the state that provide community engagement coordinator activities and outreach in Jackson and Josephine County in Southern Oregon, Lane County in the Eugene area, and then in Lynn, Benton, and Lincoln counties from Albany all the way to the Central Oregon coast. And then we have folks out of our Portland office that also specialize in outreach activities as well in the metropolitan area. So there are a couple of different ways you can contact 211. We are available Monday through Friday from 8 to 6 via phone. And then we're also available via text message and email from 9 to 5, Monday through Friday as well. You can search our database at 211info.org. And you can also text your zip code to 898211. And all calls are recorded for quality assurance. They are live, they are confidential, and each call in each situation is unique. And so we're going to treat each as such. We also have a mobile app. It's free for downloading on iPhone and Android smartphones. It is based on your geographic location, so you have the option to enter a zip code for any of the 40 counties that we service. You can look through the various categories that we have on the app, and then you can populate those in a list or on a map as well. And then if you're having trouble searching for resources, you have the option to call, text, or send an email from right within the app and contact us. And so you can search for 211 Info within the Google Play or the App Store to download that app. So last year, we reached almost 500,000 folks across our multi-channel platform. So through calls received, web visits, mobile app searches, and text messages and emails. So this has gone down quite significantly from the previous fiscal year. In the previous fiscal year, we had over 709,000 contacts. And historically, we are seeing call volume decreasing. We are seeing web visits increase. And recently, within the last 6 months, we did put blockers on our websites. We were getting a lot of external traffic from bots scraping our data. And so we put protections in place so we don't have those bots come through and scrape the data off our website out of the database and use it to publish their own resource guides or printed directories. So our call volume has gone down a bit as well, but as people become more comfortable with the mobile app and visiting our website, we are noticing that trend in contacts. So our database has over 2,600 agencies across 40 counties offering 29,500 plus resources, and those span from food and housing, medical and dental to childcare and shelter. So this is what a snapshot of a database listing would look like. This is the agency Baby Blues Connection, and they provide support and information to women and men experiencing any kind of perinatal mood disorder, their families and professionals serving this population. And so what you'll see is the contact information, website and email address. When you're on our website viewing the database, you can look at a map, and then based on your zip code, it would be 3 miles from that zip code that was entered in Multnomah County. Because they do not have a physical location, they want folks to call or visit their website for more information. So we're going to get down to the nitty-gritty and really let people know how to access the resources. We also cover fees if there are any, eligibility for folks to utilize the service hours. For this, they don't have standard hours, but they do have a message line that's available 24 hours a day. And then they also have information on their website for support group meetings, times, and locations. We'll also offer information on languages offered other than English, and then the area served. So this is an agency that offers services in the Portland metropolitan area. And then these services are all the services offered by this agency, and these are what we call taxonomy terms. So similar to the Dewey Decimal System, if you're going to the library and you're trying to narrow down a resource, we like to think of ourselves as librarians of information and assistance, so we can narrow this down from parent support groups to parent support groups from perinatal and postpartum depression, so we can get very specific. And being able to capture these specific requests are really great for our funders, and just to look at our data and be able to analyze it and figure out what services people are requesting. And then at any time, if you're looking at our website and you see any changes, or you need to make changes or report errors, if there's grammatical or spelling errors, feel free to email support@211info.org. We have a resource team of about 15 folks that spend over 12,000 hours a year updating all the resources in our database. Some are updated every 6 months, some are updated at least annually, and so we're touching each of those records on a daily basis. So looking at the top 5 needs of our callers, and this is in the last fiscal year, rent payment assistance is number 1, electric payment assistance, so for folks that are in jeopardy of having their electricity disconnected or maybe it's been shut off. Folks seeking community shelters, number 3. This includes year-round shelters, domestic violence shelters, and then severe weather shelters as well. So when it gets really cold in the winter, additional shelter sites will open, or when it's very hot in the summer, cooling centers will open. Child care resources. So we are the main hub for the state of Oregon for child care resource and referral. And so this is our one of our top 5 needs. And then food pantries. So we have a lot of folks that are experiencing food insecurity, may not know they're eligible for SNAP or WIC benefits, and so we can connect them to those resources. So when folks call, they'll be asked a series of demographic questions that are all completely optional. The only thing we really need to capture is a zip code, city, or county where they reside, or if they're calling on behalf of someone else. That way we can narrow down resources for them. We also ask for age and gender identity. We also ask race and ethnic identity as well, and we have about 30 different markers for race and ethnicity. We ask for number of people in the household or family group, children in the home, the age of the youngest child, if anyone in the household is currently experiencing pregnancy. We ask the monthly household income before taxes. This may help us narrow down if folks are eligible for certain benefits such as SNAP or TANF. We'll ask if anyone in the household has ever served or if they're currently serving in the U.S. military or if they're military dependent. And then we'll also ask if they're currently experiencing homelessness. And then based on this information, we can further assess if they would be eligible to apply for the programs such as SNAP, food stamp benefits, TANF, ERDC, so the employment-related daycare subsidy, WIC benefits, or health insurance. So all of our staff, if they're working in our contact center, if they're working on our child care referral team, if they're working on our resource team or outreach, they go through about 3 to 5 weeks of side-by-side training and learn how to listen to calls, how to take calls first and foremost. And then based on their position, they'll go into further training for their role. And so what we do during that training is learn how to provide clear direction to each and every caller, because every caller is unique and every situation is unique. We have about 8 staff on site that speak languages other than English, and then we also have a language line access to over 240 languages spoken around the world. We come up with creative problem solving, so we're not going to provide cookie cutter answers to folks. We're going to treat each person with respect and dignity and give them the tools to empower themselves to make the best choice for themselves, their loved ones, and their household. We can also escalate services when necessary, so we are all mandatory reporters. We do have a process for reporting threats of suicide, homicide, any abuse or neglect that is reported, and then we can also provide warm transfers to 911, to mental health hotlines, to CPS or APS hotlines as well. And so that is when, at that time, we can break confidentiality and ask for a first name and a contact phone number, just in case we get disconnected from that person. And then we are accredited by AIRS, which is the Alliance of Information Referral Systems. So this is a national organization that oversees the structure and flow of 211 systems across the country. So I've mentioned some of the specialty programs, including the Child Care Referral and Resource Program. We also have a 24/7 foster parent support hotline available throughout the state of Oregon. We also have a SNAP and food access specialist as well. So if folks are having trouble with their SNAP application, or they have specific questions about accessing food at a food pantry, maybe they have dietary restrictions, we have a food access specialist who can help them with that. We also have maternal and child health specialists as well. We have a screenwise specialist who can help with the breast and cervical cancer screening programs, and the Susan G. Komen program, which provides transportation options to folks living in rural areas who need to get to their appointments. We provide coordinated entry into the homeless family shelter systems in Multnomah County, as well as Lynn, Benton, and Lincoln counties. And then we also respond during times of emergency. So last year, we had a double whammy taking place. We had an eclipse hotline that ran for 9 days. And then we also were responding to the wildfires in the Columbia River Gorge, Central Oregon and Southern Oregon as well. So in times of emergency, we are assisting the 911 systems and providing that information that folks need based on if there's an evacuation order, if folks need to get to a shelter, or if they just have general questions about the well-being of their loved ones. So the MCH program, it serves the state of Oregon. We have bilingual specialists and access to language interpretation. So we're really focusing on children's health programs, prenatal care, postpartum support, WIC and breastfeeding support, basic needs such as formula, diapers, clothing, and then home visitation programs. And so this is for pregnant and postpartum women and youth ages 0 to 19. Our MCH specialists also focus on reproductive and sexual health. This is for all ages and all gender identities. And we can provide more information on pregnancy testing, options counseling, fertility services, STD and HIV testing and treatment, contraception, Pap smears, annual exams, and HPV vaccines. Our child care referral program started in July 2016, and so this is a statewide partnership through the Early Learning Division, where we're providing free child care referrals for parents and caregivers. And then we're also hosting a separate database of over 6,000 child care providers throughout the state of Oregon. So we have a team that updates that database every day. They do vacancy checks every 3 months. And then we have a team that answers phones, the phones to provide those free child care referrals to parents and caregivers. And these are all confidential, and they're based on their location, the type of child care requested, hours needed, ages served, languages spoken, and other factors that may come into play. We can provide referrals over the phone, via email or text messages. And then we have extended hours. So that line is open 7 a.m. to 11 p.m. Monday through Friday, and then weekend hours to 8 a.m. to 8 p.m. So we're really trying to touch as much of that time frame as possible, since we know parents have varied work schedules and may need childcare 7 days a week. The foster parent support line is a 24-hour support line for DHS foster parents. We're partnering with the Oregon DHS Child Welfare Center, and this is focused on after-hours times when the caseworker might not be available, and then we're able to directly connect with on-call workers and triage crisis calls when warranted. And then we also provide basic information and referral about parenting skills, parenting classes, and behavior and developmental programs as well. And then year-round, we have some seasonal programs. So right now, we are ending summer, and so we had been providing information this summer about farmers markets that accept SNAP benefits and accept the senior farm direct vouchers. We've been offering information about cooling shelters that have been open when it's been hot. And then also right now we have folks calling about school supplies and backpack drives, where to get those kiddos ready for school. And then pretty soon our resource team will start updating our holiday records. We start getting phone calls toward the end of September from folks looking to sign up for Thanksgiving food boxes and holiday adoption programs as well. And then severe weather season will begin November 1st, and that runs through March 30th. So we have a partnership with Multnomah County that when severe weather is called, if certain weather elements are taking place, additional warming centers and bed sites are slated to open, and we keep up to date with those sites to report on bed counts and then also arrange for transportation. If someone is physically on the street and unable to get to a shelter, we can arrange transportation for them through some of the local taxi companies to get them to shelter for the night. And then in the spring, we're also looking at tax preparation assistance for folks that need help filing their taxes, and then kindergarten registration as well. And then all this demographic information that we're collecting. So we're putting this in our reports, which are available on our website, 211info.org/reports. So you can look there at the top 10 services requested by county or by region. You can look at the demographic information of folks that are contacting our agency, what referrals we're providing, and then potential service gaps. So maybe where there wasn't an appropriate referral available, a service was at capacity, or maybe the person had already exhausted that option and were no longer eligible, or they had an application pending. So we mark those unmet needs in our database when we're on a call with someone. So other than that, that is the end of my presentation. We're also on social media as well. We're pretty active on Facebook, Twitter, and Instagram. And check out our website for more information about our programming as well. If there's any questions, I'd be happy to answer them.
Thank you so much, Kara. And this was a ton of great information. I think that there's a lot of connections with a lot of the organizations that our CPs are part of are probably part of your network or could be. Going to open up the question box for any questions you have about 211 info, any questions for Kara. And by the way, I did put the slides into the handout section of this webinar for those of you who are here live. You can go ahead and grab that. I'll also make sure that those get uploaded onto group site so that you all have access to it. I see some hands raised, but I don't have the functionality to unmute you because there are so many of you on the line. So if you could type something into either the question box or the chat box, I can read it out loud for you. I think everyone's being shy today. Okay. Let's see here. You want me to read these out loud? Will that be
sure, helpful? Yeah, I'm not seeing the questions in the chat box.
We have one. Are there areas of the state in which there are low amounts of information through 211?
Yes, so some of the rural counties in southeastern and eastern Oregon, a lot of times we will ask folks, how comfortable are you driving 20 miles to the nearest food pantry, because there may be only one food pantry in a 50 to 75 mile vicinity of that person's zip code or residence. And so what we do is when we're talking to partners and stakeholders in those areas, trying to learn about new agencies that might open up, or if there are sometimes faith-based programs that only open up to their members or congregants, we will often ask if they ever open up to the general public, just as an option for folks who might not be able or might not have the transportation to drive the distance to the closest food pantry or other service.
Mm-hmm. Yeah, and I think that, in fact, we have a question that is a good segue from that, which is, how does the nonprofit get their info included in?
So that's a great question. So I'm going to bring up our website here. So 211info.org. And right here on the screen, you can click here for providers, and this is where you can get listed or update your information. So if a provider is already listed, they can click over here to update their information. And every provider has a unique username and user ID and password that they could enter to go in and make changes to their record at any time, which is really useful. And then if you're not listed, there are options here where if they'd like to create a new listing, if they're in the database but forgot their password, or if they just have a question about it, they can fill out the contact information here with their agency's info as well. And then there's a text box toward the bottom. They can submit that, and this goes to our resource team right away. And then if they're not sure if they are a good fit for our database, we have an inclusion policy over here. Oh, and the link is broken, but I know why. So up here at the top, we have the inclusion policy. And so this talks about how our database contains how we keep it current, robust, and helpful. So just some basic information. As long as the agency is providing a health and human service that is no cost, low cost, or has a sliding scale fee based on income, they've been in operation for 6 months or more, and they're serving the general public without discriminating and without requiring consumers be members of the organization. And then we have a more detailed explanation of what programs are included. So if you have more questions about the inclusion policy, it's right here on our website as well. And so what happens is, when we're presented with a new agency, our resource team meets biweekly for an inclusion meeting to talk about the agency, the services that are being provided, how accessible are they, is this filling a gap in services where maybe that service didn't exist before, and we basically come to a collective as a team and vote, and most of the time, I would say 95% of the time, we will go ahead and include agencies.
That's fantastic. I think that 211 is a great tool for our community partners to use, and also will be a tool through which community partners can also share the work that they do, because we have a lot of really fantastic and diverse organizations who are involved with our OHP certification. So there's a ton of great overlap.
Nice.
And we are just reaching the end of our half hour, and I don't see any questions. So I'm going to give you all a little more chance just in case there are any last-minute questions that have come up. This is being recorded and will go up on our website for our community partners. And I will make sure that these slides get out as well. So look for them on our community partner resource group site. And I think we're good. Thank you so much, Kara, for your presentation.
Yeah, you're welcome.
And
not a problem.
And her information is in the slide deck that we have access to, so I'll make sure that gets out to you all too. Great. All right, I'm going to go ahead and end this webinar, and we'll see you later. Thank you all for joining us.